Music Therapy and Autism by Rebecca Adams. Characteristics of autism when it comes to communication. Deficits in social communication, for example, from abnormal social approach and failure of normal back and forth conversation, to reduced sharing of interests, emotions, or affect, to failure to initiate or respond to social interactions. Deficits in nonverbal communicative behaviors, ranging from poorly integrated verbal and nonverbal communication to abnormalities in eye contact and body language, or deficits in understanding and use of gestures, to a total lack of facial expressions and nonverbal communication. Deficits in developing, maintaining, and understanding relationships ranging, for example, from difficulties adjusting behavior to suit various social contexts, to difficulties in sharing imaginative play or in making friends, to absence of interest in peers. Characteristics of autism when it comes to behavior. Stereotyped or repetitive motor movements, use of objects or speech. For example, simple motor stereotypes, lining up toys, or flipping objects. Inflexible adherence to routines or ritualized patterns of verbal or nonverbal behavior. For example, extreme distress at small changes, difficulties with transitions, rigid thinking patterns, greeting rituals, and a need to take same route or eat the same food every day. Highly restricted, fixated interests that are abnormal in intensity or focus. For example, a strong attachment or preoccupation with unusual objects. And lastly, hyper or hyporeactivity to sensory input or unusual interest in sensory aspects of the environment. For example, apparent indifference to pain or temperature, adverse response to specific sounds or textures, and excessive smelling or touching of objects. There are specific criteria when it comes to diagnosing autism. First, the symptoms must be present in early development, but may not become fully manifest until social demands exceed limited capacities or may be masked by learned strategies in later life. Second, symptoms cause clinically significant impairment in social, occupational, or other important areas of current functioning. And lastly, these disturbances are not better explained by intellectual disability or global developmental delay. Intellectual disability and autism spectrum disorder frequently co-occur. To make comorbid diagnoses of autism spectrum disorder and intellectual disability, social communication should be below that expected for general developmental level. The definition of music therapy. Music therapy may be defined as a planned, goal-directed process of interaction and intervention based on assessment and evaluation of individual clients' specific needs, strengths, and weaknesses, in which music or music-based experiences are specifically prescribed to influence positive changes in an individual's conditions, thoughts, feelings, and behaviors. There are 5 types of music therapy. The first one is receptive music therapy. This involves listening to live or recorded music that may elicit certain reactions or emotions in the client. Next is compositional music therapy. This involves the creation of original music by the client. Third is improvisational music therapy. This involves the therapist guiding the client to creating music spontaneously. Next is recreative music therapy. This requires the client to learn how to play an instrument and then rehearse and perform a piece. And lastly, activity music therapy. This involves structured musical games set up by the therapist for the client. Statistics for music therapy. Researchers have found that 56% of child psychiatrists and 14.5% of pediatricians recommended music therapy for the treatment of autism. These percentages are particularly impressive given the lack of empirical research support for music therapy. It has also been said that individuals with autism prefer an auditory stimuli as opposed to a visual stimuli. Music therapy background. Music therapy has been found to facilitate motivation, communication skills, and social interactions, as well as sustaining and developing attention. The structure and predictability found in music assist in a reciprocal interaction from which tolerance, flexibility, and social engagement to build relationships emerge, relying on a systematic approach to promote appropriate and meaningful interpersonal responses. Effects of music therapy. Music therapy has been shown to improve communication behavior, language development, attention span, social skills, and emotional responsiveness. Improvisational music therapy. This technique is the main music technique that is used today. Improvisational music therapy allows the therapist to be responsive to the child and to facilitate active and receptive music elements, while the structured set songs rely on receptive music techniques and allow for little flexibility in the mode of presentation. It is an insight-oriented therapy that was implemented by certified music therapists. An important guideline in improvisation is to include repetition of ideas, sequences, and repetitive phrases to ensure that there is some direction and familiarity in the musical material. Vibroacoustic music. This technique has been seen to be an effective form of treatment for individuals with developmental disorders and challenging behaviors. In vibroacoustic music, specially designed speakers are built into a chair, bed, or other equipment to administer low-frequency sound vibrations that enable the listener to hear and physically feel the music. Vibroacoustic music technologies originated in Scandinavia in the 1970s and have since been enjoyed widespread in hospitals, healthcare facilities, and wellness programs. Music alone has been known to evoke genuine emotion in listeners, and in combination with low-frequency sound vibrations, vibroacoustic music is believed to enhance the emotional reaction to music. Vibroacoustic effects. Vibroacoustic music has been known to reduce anxiety, reduce muscle spasms, reduce blood pressure and heart rate, and reduce the frequency of self-injurious behavior such as hitting the head, face, or ear, self-scratching, eye-poking, and self-biting. Past research. The first meta-analysis on the broader field of music therapy for children and adolescents with any psychopathology was published in 2004. That review indicated that music therapy generally has a medium to large effect on this broader population. However, only one of the included studies addressed autism spectrum disorder specifically. The findings from these studies are important because they demonstrate the potential of the medium of music as a therapeutic intervention for autistic children. And although there is great potential for this therapeutic technique, there needs to be more research done in the future so that we are able to generalize the findings to the full population. Here are the references that I used for my project. Thank you all for watching my presentation.